Hi, everybody. Today I'm answering the question, why is care coordination so frustrating for caregivers? I'll share insights into the experiences of caregivers who provide support to aging parents, grandparents, spouses, and others through coordination with the healthcare system, which, as we know, can be challenging if you're highly involved. I will also share information about a Medicare benefit called chronic care management that's available to many older adults over age 65 who have two or more chronic health conditions. So if your doctor's office hasn't mentioned this benefit, you can ask about it. Then I'll also share reasons that care coordination can be complicated or frustrating and how caregivers can advocate to make all of this much less frustrating and so much easier. So stay with me. I'm Pamela D. Wilson. I'm a caregiving expert, advocate, and speaker. Please like and follow my YouTube channel so that people looking for similar information can find the channel. Please also comment. A simple thanks for the video or sharing your story makes a huge difference for other people who are searching for information on caregiving and all of the topics that I cover. You can also visit my website. It's PamelaDWilson.com, where you can find my online webinar programs, my podcast, The Caring Generation, my blog, and there's a contact me form where you can request a personal consultation. So let's start with the idea of care coordination and what it means. Care coordination can also be called care management, and these are terms that the healthcare system uses, right? Consumers and patients and caregivers don't always use these words, but when we get involved in the healthcare system, we learn a lot of new words. Now, many times this role of coordinating care, taking care of your parent or spouse or grandparent, falls to a family caregiver who knows the most about the person who needs care. So now let's talk about care coordination from the perspective of a healthcare system. Healthcare likes to use the word patient for people who need care. Even though we may not feel like we're a patient, the minute you get into the healthcare system, you are called a patient. So in healthcare systems, there are also people who are care coordinators and care managers, but they may not have this title, so you may not view them that way. They may be known by a title of a nurse or a social worker or a discharge planner or a care coordinator or a care manager. Now, to make this a little more complex, there's also this term called chronic care coordination. And this term matches up with a Medicare benefit. So Medicare is for people over age 65 mostly. It's a benefit that offers 20 minutes a month of care coordination services in addition to going physically to an office, right? So the conditions that would qualify somebody are any type of chronic disease. So if you don't know what those are, there are things like a heart condition, high blood pressure, arthritis, diabetes, a breathing problem, COPD, any type of kidney disease, cancer, even depression, right? So a lot of common diagnoses fall under this chronic care coordination Medicare benefit. So in addition to this 20 minutes of contact, you have a chronic care coordinator who's a person that helps you, which caregivers need help navigating the medical system because it's so complicated, as do older adults. So this care coordinator is going to create a plan to address these health issues. And they may be able to help you with coordinating appointments between doctors and hospitals, other medical specialists, testing centers. Plus, you're going to have 24/7 emergency access to somebody to call if something happens. Now, many times you have to ask for this benefit because they may not offer it to you, or maybe they're offering it to you and they're not explaining that it's a benefit. It's called chronic care coordination. So if you need help from your doctor's office and you're caring for somebody over age 65 and you are this person or their caregiver, call your doctor's office and find out how this works. You may have to set an initial in-person appointment, but after that, it could be telephone and virtual. So now let's look at caregiver challenges working with healthcare systems, hospitals, nursing homes, labs, pharmacies, home healthcare agencies. A lot of people are involved, right? So you might have a contact person who is your care coordination person, right? Although you may not realize that this is what they're supposed to do. So it's always okay to say, hey, are you the person that helps me coordinate care? Or are you a care manager that's going to help me? Okay, even though they're a nurse or a social worker by a different title, they still may be able to do that for you. So the second challenge that caregivers run into is that if a loved one has a lot of these chronic health conditions, high blood pressure, arthritis, something else, the number of people that get involved increase, right? So instead of maybe only dealing with 2 people, you're dealing with 2 or 4 or 6 people, right? And that can get very confusing. So I'll give you an example. A parent who has, let's say they have a heart condition and they're also depressed, and maybe they have a little arthritis and they've got some breathing problems. So all of these conditions can involve seeing medical specialists, like a cardiologist for the heart problems, a psychiatrist or a psychologist or a counselor for the depression, a rheumatologist for the arthritis, and a pulmonologist for the breathing issues. Now, you may think, gosh, too many people involved, right? Well, the value of specialists are they're specialists and they know things that your primary care doctor does not know, will not consider, and sometimes even things that your geriatrician doesn't know or consider. So in addition to these specialists, then you have this primary care or geriatrician, right? So you have 5 or 6 doctors and you're thinking, oh, this is just too much. Well, it can be very helpful if you have people to help you coordinate this type of care, right? So one of the number one things is it's important if you have multiple physicians for each of them to know that they exist. So if you're going to one physician, take a list of the other ones, their specialties, give it to the nurse, have them put it in your file. When they do that, 5-minute introductory visit, how are you feeling? What medical conditions? Have your medications changed? Give them that information. Now, they may then be able to help you start coordinating, or they may not have anybody. So as that caregiver, you are going to be the person who's going to have to coordinate care because there may not be somebody in the doctor's office to do this, especially if you live in a rural area or it's a small doctor's office and they don't have a lot of staff. Now, the area of difficulty is if family caregivers, due to a lack of experience, so if you've never done this before, or if you're not used to working with healthcare systems, right? Who is, right? If this is your first time doing this, you may not know what you should be coordinating and who you should be telling what, or even what questions you should ask. So on this topic, on my website, PamelaDWilson.com, there's a whole course called Caring for Aging Parents, and there's a section on care coordination and how do you attend doctor appointments and how do you prepare for doctor appointments and what information should you give to the doctors, what's important. This can save you a lot of time. So a care coordinator or care manager's role, okay, whether you're a family member doing this or it's a professional, is to make sure that the entire care team, okay, the care team is everybody involved. The primary care, the specialists, home care if they're involved, other providers, right? To make sure that everybody knows what's going on and that communication is going well. Now, there's gaps, especially on the healthcare side, because of computer systems and medical records that don't share information. So sometimes there's gaps on the doctor side, and then there's gaps when the doctor side or the clinical side, as they like to call it, crosses over into the community care side or the social care side. Because all of these people have different goals and motivations and financial incentives of how they get paid. So how does all this, these gaps, how do these gaps happen, right? So let's say that you're a caregiver and your parent needs transportation. So you have this community care transportation company that you call when they need to go to the doctor, right? So let's say that your doctor says to your mom, I want to see you in 3 weeks, and then I want to see you in 3 more weeks. So your parent or you call the transportation company to say, hey, we need this appointment. It's on this day, pickup time, arrival address, all that, which is great, right? But as you know, in some cases, these transportation companies are not reliable. Sometimes they may be late picking you up. You may be late. You may miss an appointment. And so on the other end, on the clinical side, right, if the doctor's office does not know that a transportation company is involved, because you haven't mentioned this, right? You haven't informed them, They may view your parent as somebody who makes appointments and doesn't show up, or they're always late. And so these no-shows or these missed appointments are huge concerns for medical offices because they try to keep on schedule, right? They try to make people not wait too long. And if somebody's late, then that causes everybody else to be late. It's a big concern. It's a big mess, right? So as that family caregiver, telling your doctor or the nurse in your doctor's office that there's a transportation company involved is very important, so that if a glitch happens, your parent doesn't show up late, right? And the doctor's office says, oh, you showed up 30 minutes late. You should have been here 15 minutes early. We can't see you. They may be a little more flexible in arranging things if they know that you don't have control over the transportation. But unless you tell them, they can't help you. So, as mentioned, you want to find a contact who can help you. Could be a nurse in a doctor's office, could be a social worker, somebody else who doesn't even have the title of care coordinator. And if somebody offers to help you, just so you know, right, ask like how they help and what they can help with, because honestly, for caregivers, help navigating healthcare systems that are super complicated is very beneficial because you don't know how all the stuff works behind the scenes, right? And so this kind of leads into talking about frustrations experienced by caregivers and patients, so that you can see how all this comes together. And the idea would be to identify the potential problems before they happen so they don't happen. So for this reason, it's important to understand who's coordinating care, the role of care teams, what information you need to provide, and just how all of this stuff works together and the motivations, right? So it's also important to understand the interest and the motivation of the person that you care for. Will they go to doctor appointments? Will they participate in medical care? Will they do physical therapy if it's prescribed? Because I will tell you, if they don't, if your mom or your dad or your spouse or somebody consistently refuses care or doesn't follow through with medical advice, what can eventually happen is these declines or refusals get noted in the patient chart, right? And eventually the doctor's going to stop offering options for care or options for treatment because they know that your parent is not going to do this. So it's important to really have two-way conversations with your parent and the doctors to say, what is this treatment? What are the benefits of this treatment? What if we don't do this treatment? So that you understand the pros and cons, and then you can choose to say, yes, we're going to do this, or no, we're not going to do this, but it's because we have this concern. Can you address this concern? And if so, then we may consider to do this, right? You really have to have thorough two-way conversations. So caregiver frustrations, you know all these, right? Accessing services, getting people to call you back, long wait times for appointments or treatments, poor communication, no communication, you have tests done, nobody calls you with the results, and just a general lack of understanding of how all this stuff works, including having too many people involved. So let's talk about care plans for a minute. So a care plan is another medical term, right, that doctors and healthcare systems use. But it's really just like, what are we going to do to treat this condition, right? If somebody has high blood pressure, what do we do? Do we prescribe medication? Do we tell them they should exercise? Do we tell them they should restrict their salt content? What is the plan and the coordination to make this happen, right? And so there can be care plans for all the health conditions that I mentioned before, including, again, this chronic care coordination benefit offered by Medicare. So don't forget to ask about that. So an example of this is a physician sends an order to home health for physical, speech, and occupational therapy because a parent has fallen in the home and they've gotten physically weak. And so the goal is to keep that parent at home, to improve their balance, to make them physically stronger. So the care plan of the home health company involves exercises daily, and they may provide you with a sheet of exercises. They may show you how to do the exercises and other information and suggestions, right? And so that's considered a care plan. So in all the places where care is received or provided, there's this expectation that you, the patient, or you, your parent, is going to participate. Now, admittedly, the more number of people involved, the more complicated this gets, because One doctor may want one thing, and another doctor may want another thing, and the third may want something else. And who's sharing all of this information? If there's nobody at the doctor's office, it has to be you, the caregiver, or you, the patient. Having a lot of people involved, it can be intimidating, especially if it's not clear who's responsible for doing what and following through, and is there a timeline that we need to get this done in? So imagine this, your parent has, and maybe they do, right? 5 doctors, all giving instructions, nobody making sure that the physicians are talking to each other. Things are getting just all messed up. And you as the caregiver are trying to say, you know, Dr. X, Dr. Y told me this. Can you get this updated? And so part of the problem is the healthcare system doesn't tell you this, but it's a huge problem. If physicians do not share the same electronic health records system, they may not be able to share a file or send an email. And they have to pick up the phone, which is more time consuming, right? So communicating then may require extra effort from you, the patient. If you have to print documents off a health portal and then take them to your other doctor, make sure that doctor gets them scanned into their record system so the information is there. All of this honestly can be very time consuming and frustrating. And honestly, keeping track of all these records and everything and information can turn into a job all in itself. Now, on the other side, the good part, right? The existence of these health records and online health portals can speed communication between doctors. It can make things for patients easier, like scheduling appointments and sending a note to a nurse. Now, the challenge is if you have a parent who doesn't have a computer or they're not technologically savvy, this can be like way over their head. And so it's going to fall on you to get permission to use their portal to do this with a release or as medical power of attorney, right? And so while all of this virtual stuff can be a real plus, for people who don't know how to use the platforms, it can initially be challenging, but once you learn it, it can save you really a lot of time and a lot of stress. Now, again, going back to healthcare speak, doctors and healthcare systems use these electronic health record systems. They abbreviate them as EHR, so Ellen, Harry, Robert. And again, problem, right? If they're not talking to each other, if the information is not exchanged, and if nobody in that office is taking responsibility for making sure that information is updated because they don't know how to use the computer program, right? They also have to learn how to use all of these computer programs. A lot of inaccurate information can exist in your chart or in a loved one's chart. And who's going to take responsibility to correct it? Well, for better or worse, that falls on patients and their caregivers. So for example, your health record may have inaccurate information about appointments that you went to or treatments that you did, or there may be notes in there saying, you know, you need to have this test by a certain date or a vaccination by this certain date, and maybe you've already had these done. And the people who did the blood test or the people who did like maybe the mammogram or colonoscopy or something don't share the same health record system, so those records never got from place A to place B. So that is up to you to make that request or to take those reports or to tell your doctor to request the information, because somebody has to manually do these things if the computer systems are not talking to each other. And honestly, sometimes when they do talk to each other, the information is still inaccurate. It can be really frustrating if you are the patient or the caregiver. So it's also very important for you to make sure that medications and supplement information is up to date, because frequently it gets out of date. Sometimes there's multiple, pills that you're taking for one thing that got discontinued and they never got out of the records. So again, you've got to make sure that these records are accurate, because let me give you an example. So an example is a medication that doesn't work well if a person takes a specific vitamin or a supplement. So let's say that you take folic acid, or maybe you take vitamin K or something, and you're on a medication that causes side effects if it's combined with one of those supplements. It's important for your doctors to know everything that you take, because if you're experiencing side effects, it could be something that you're doing unknowingly that's causing you to have these side effects. And so then what happens, right? Then maybe you stop taking the pill because you have all these side effects, but yet it's a vitamin that's causing that. And if you knew that, you would take the pill and you'd feel better. So when you work with healthcare professionals, it is really okay to say, hey, you know what? Are you the person who's responsible to help me with care coordination? And if not, is there somebody that I should talk to? It's also possible that as this caregiver or patient, you might work with more than one care manager or more than one care coordinator, and they don't know about each other, again, because of this health record sharing or not sharing. But so the healthcare system uses a word for this. They use a word called silo, S-I-L-O. And so for patients and consumers, we can think of a silo as a specific type of business, right? So a primary care doctor's office can be one silo, a nursing home can be another silo, a pharmacy can be another silo, a home health care company can be another silo, a food bank, another silo, right? A transportation company, another silo. They don't have electronic systems that speak to each other, so they don't know what each other's doing. And so that's why they're called silos. So they have no way of just automatically pulling up your record or viewing information or sharing information. This information sharing goes by another big word called interoperability that the healthcare system uses. And basically what it means is data is not shared electronically, right? This has been a work in process for the healthcare system for years, and there's still a lot of work to do because everybody cannot share these electronic health records. So complications that happen because of silos that you should be aware of if you're coordinating care. So let's say that your loved one is in the hospital and there is a discharge planner, right? So this discharge planner, her job is to get your patient or your parent out of the hospital, right? Send them to rehab or a nursing home or send them home, right? So their motivation, though, they have other motivations. One, they need to get you out of the hospital so that more patients can come in. Two, their second motivation is to avoid your parent returning to the hospital within 30 days, because if they return under some conditions, that hospital can be financially penalized. So they want to avoid extra costs for the hospital by sending you home and making sure you don't come back. So how do they make sure that you don't come back, right? They transfer your care responsibilities to somebody else, to the nursing home staff, or to you and your caregiver. And if it's to you and your caregiver, so if you're going home, it's very important that the patient see their primary care physician within a few days of discharge. Why is this important? Because you as the patient may be like, you know what, I just got home from the hospital. I am not going to see my doctor. Well, it's important because errors happen, right? So what can happen to facilitate this process is that hospital discharge planner or somebody from your doctor's office may call you the day after you're home from the hospital or 2 days after and say, hey, you know what, it's time to make an appointment. Come see us, right? And so again, that helps the hospital not be fined for you coming back if something was inaccurate in your discharge instructions. It helps your doctor do their job because their job also is to keep you out of the hospital. So you may think this appointment is unnecessary, but here's the deal. The hospital records may not match your doctor's records, or the hospital may have prescribed some medication that goes against other medications you're taking, or maybe they discontinued something that you really need for your well-being and your health, right? So that's why it's important to go to the doctor to make sure that nobody made any mistakes and everybody's on the same page and we all have a plan, okay? So then, let's say there were orders, you went home and there was orders sent to speech, physical, occupational therapy, right? So you're going to get a call from somebody at a home health agency and you're thinking, oh my God, all these people are calling me, right? They are, right? Because now multiple people are involved. So as you can see, everybody involved in healthcare may work in different companies in different areas, which is why they use this term silo. But it's also why caregivers and patients get so frustrated because you have all these people calling you and you don't know how they're involved and you don't even know like what you're supposed to do. And a lot of times, the home health care agency will call the parent who's like, you know what, I don't want anybody else coming to the home. I'm going to refuse this. And you as the caregiver didn't get the phone call, so you couldn't encourage your parent to say, you know what, You need these exercises because if you fall again and break another hip, you're not going to be able to live at home, right? And then there's other things like seeing multiple doctors, and I'll use blood tests as an example of this. So your primary care once a year may do a full blood panel that includes like a cholesterol check and other stuff. If you go to your endocrinologist, they may want something related to your blood sugar. If you go to a cardiologist, they may want to run a different test. So rather than having to go to like 10 blood tests a year for 5 different doctors, you as the patient, you as the caregiver can say, look, can we do this once a year or every 6 months? And I'm going to call all of you and you're going to give me the orders and I'm going to go to one office and get all of this done so that my parent doesn't have to go to 5 appointments and be stuck 5 times with different needles and all that kind of stuff. It's just a hassle, right? So to save time and multiple appointments, this is where you as the patient and you as the caregiver can get involved because you may have to talk to everybody and gather all this information if there's not somebody to help you there, right? So one more example, and this kind of relates to pain medications, right? So let's say that your loved one has just horrible arthritis or some other type of pain, and they are prescribed a medication, but it has side effects that they don't like. And so maybe your parent feels dizzy or nauseated or they can't sleep. There's just something that this medication is doing that they don't like. So they stop taking it and they don't tell you and they don't tell the doctor. And next time they go back to the doctor, they're like, doctor, I'm in so much pain. And the doctor's like, well, is the pain pill working? And the patient's like, well, I discontinued it. That is not a good solution. If you're going to change anything or if you're having side effects or complications, be persistent in communicating with the doctor's staff, and you can do this via an online portal. Send them a note saying, hey, I started this medication. I'm noticing all these new things or these side effects I should know about. Now, they should have told you about the side effects, but many times they don't have time to do it, which is unfortunate because, again, patients run into a lot of side effects that could have been prevented if only they knew, right? The bottom line is that healthcare systems treat, for better or worse, thousands of patients a day. You're lucky if you get 15 minutes at a doctor appointment, which makes it difficult to get everything you want addressed. So as that patient, as that caregiver, it's up to you to learn about care coordination and care management so that you can make sure that your loved ones receive the care that they deserve. I'm Pamela D. Wilson. I'm a caregiving expert, an advocate, and a speaker. Thanks for being here. Please like and share these videos to other people so that other people can find hope, help, and support. Also check out my website, PamelaDWilson.com. There's a lot of other helpful information there. Thanks for being here. I look forward to seeing you all again soon in another video.